My name is Andy Haines, and I'm from the London School of Hygiene and Tropical Medicine. I was for many years the director of the London School, and I'm now there as an academic. I'm concerned about the issue of violence in health professionals because I think it's a major cause of failure to address many of the global health issues that we see confronting us. So in some countries it's a serious cause of disruption of health services and means that people can't get the kind of care that they need, and it also disrupts public health, so things like immunisation campaigns and so on. And I think it's been very much a neglected issue in the academic community, but also in the broader medical and nursing community. So it's something I'd like to see addressed. I've only once directly experienced it myself when I was working in an emergency department, not in the UK, in another country, and someone came in packing a gun and making it very clear that they wanted to be treated in front of everyone else. That certainly focuses one's attention. And I was very aware that as a health worker, you're extremely vulnerable. There's no one there you can call on. You have to deal with the threat as it confronts you. And it also made me feel that if I was working permanently in that country, it would certainly have been very intimidating indeed, and would have made me wonder whether I was going to emigrate or whatever. So I only have that one personal experience. But more recently, of course, hearing about many of the atrocities that have occurred, particularly attacks on ambulances, attacks on hospitals, attacks on medical and nursing colleagues, really brings it home that it's having a major impact around the world. And it's a topic which we haven't spoken about enough, and which I think has become somewhat gone underground, if you like. And so I very much welcome the ICRC's campaign to raise the profile of the issue. I would like to see much better evidence, because I'm an academic, so I think evidence is very important in documenting the size of the problem, the nature of the problem, but also potential solutions. Obviously we can't stop at just documenting the atrocities that are taking place, but also trying to develop policies, strategies, both for engaging with non-state actors but also state actors, to try to actually address the root causes of the problem. And part of that lies in better education and training, not just of health professionals about the risks to them, but also to the wider community, and I think to training institutions for armed forces, to reach out to faith-based organisations, to appraise them of the magnitude of this kind of problem so that they can also take a stand on the issue. And I'd like to see a facility for almost the real-time collection of data. Obviously that data, we have to be sure that it's correct, so there have to be built-in checks. But I think by analogy with some of the disease outbreak data that we've been seeing recently, which has been collected almost in real time, which can be extremely useful for public health purposes, I believe that collecting this kind of data from around the world, making it accessible in a single site, quality assured, would have a very major impact on the profile of the problem and also in strategies to address it.